Hello everyone. Today we will be discussing auditory or sound related issues in children with autism. These issues can range from over responsiveness, like shutting their ears, screaming when there is a lot of sound around, or under responsiveness, when they're just okay with any sound, they don't even respond to their name or instructions given to them. How to deal with these areas? Yes, earmuffs. They are considered such a simple way in which you can drown out all the sounds, and the child will be comfortable if they have over responsiveness. But isn't that a temporary thing? Are you going to put it in every social situation? Because there will be sounds, there will be crowds. Or if the child goes to the school, if they are going to wear those earmuffs all the time, how are they ever going to listen to the teacher? You really need to work on something known as desensitization. Make your child familiar with all these sounds in the environment. Tell them how to locate the source of such sounds. These sounds can come from anywhere, from the kitchen, from the bathroom, from outside. Take them so that they can see what is the source of the sound and explain to them it will be over. You cannot wait for these sounds to come from the environment. So what to do? Play sounds on your phones, on your laptops. Play them in very low volume for the child to understand what is it. After that, you can increase the volume slowly so that the child is okay. And then you can suddenly play it while the child is playing or eating or any time in which the child can be distracted. A common mistake that we make is that we try to remove the child from that environment. But how many settings are we going to change for the child? So, don't let them escape, but try to comfort them. A simple hug, giving them some kind of items that can calm them down, help them self-regulate, like chewable items, fidget toys, or any kind of sensory things that calm your child will help. Even playing some simple music in the ears sometimes helps. But we also need to know the reason why your child is screaming whenever they hear sounds. Is it that they really have some kind of sensory defensiveness and they're just used to screaming at that time? Or they're just bored and irritated and they're just making noises, and usually when they're watching TV or they're busy in their play, they don't care about those sounds. Or third, it only happens in social settings because they need attention. So at that time, just handing your child, for example, if they like a soft toy, wouldn't that be beneficial? Is it okay to allow your child to scream and shout and let you leave a place, or it's better that they carry a soft toy around? Very small changes in the routine of the child sometimes help. For example, if they are doing some activity at home which you want them to focus on, or even in the classroom, why can't they sit close to the person they are communicating with? That is, maybe the teacher at school, so they could be in the front desk or sitting close to the teacher, sitting away from windows and doors. Is that difficult? At least at home, you can apply some kind of carpet so that there is less sound, less echoes. Think about it. If your child really has this kind of sensory defensiveness with sounds, what do they really have to deal with at school? They have to deal with the sound of the teacher, other students, any kind of surrounding sounds in the school. For example, bells. There could be echoes of children running on the floor. So many sounds that they can get distracted by. Very important. Prepare your child if any such situation has to happen. For example, it's going to be break time soon. Allow the child 5 minutes of self-regulation. Let the child stop activity there and then so that they can calm themselves down. Maybe give them something to self-regulate so that when they have to enter such an environment, they do not react that aggressively. You'd be surprised, but children with such kind of sensory defensiveness, do you know what they hate most? You talking all the time. And it does not apply to over-responsive auditory but also under-responsive. For under-responsive, you're talking so much that they don't care what you are saying. Try to keep your instructions as simple as possible. So instead of saying, oh, you're putting it wrong, put it in the right jar, or these blocks are not arranged nicely, put them color-wise, see how many are there, count them. Even I can't follow that fast. So why don't you try to follow with one instruction at a time? Let's arrange these blocks. Green, yellow, red, pink. One person talking to the child so that they can focus better. And you know what is the alarming thing about it? Yes, children with autism are supposed to have some kind of stereotype of repetitive speech. But think, aren't you doing the same thing to them? You are talking to them continuously, repeating the same thing over and over. Put it in the box, put it in the box, put it in the box. What do you think they are going to learn? Box, 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 box. You are pushing them towards repetitive speech. The lesser instructions you give, the better they will be able to focus and understand. I always hear about this. Our child makes so much noise in the house. They're humming all the time, making sounds all the time with their mouth, or they're throwing things to make sound or banging things all the time. What do you think they're doing? Irritating you? They don't care about irritating you. They just want to self-regulate, or they're trying to focus on an activity or on something, but at the same time, they need to calm down. Have you never flipped a pen in the class before, or just shaked your leg during a meeting? That's what they are doing in their own way. So instead of asking them to just stop, because it's not going to stop, they need an alternative. You know, there is a part of our body that shares the function of both sounds and balance. Our ear. Our inner ear is responsible for the balance of our body. Of course, it's connected to the brain, but if you need to improve the sound part, why don't you also work on the balance part at the same time? If you try to challenge their balance by giving them some kind of obstacle courses or trying to give them some kind of unusual activities like walking backwards, jumping, or running from one particular location to another with a purpose. For example, dropping blocks somewhere or throwing a ball and getting it back, or throwing it at a target and then trying to hit it again. Some kind of physical activity or challenges are really going to help your child to improve their response to sound as well. Engage them also with visual cards and keep the visual demonstrations or visual cue cards simultaneously and keep them for a longer duration so that the child has that extra time to respond. Whenever you want your child to enter any kind of crowded area or any kind of social setting where the sounds are not comfortable, try to give them a timer. This is the time for which you have to endure it. After that, the moment the timer goes off, you can come back inside or you can leave the area. You are allowed that privilege. Try to apply these very simple techniques. Mention in the comments if you have any other doubts about auditory behaviors in children. I would really like to address them, and give me suggestions about more videos on this channel. We'll meet again soon.